Hi everyone. As mentioned, my presentation is titled Detecting Patient Position Using Bed Reaction Forces for Pressure Injury Management. So you may be asking yourself, what are pressure injuries? Pressure injuries are localized damage to the skin and underlying soft tissue that are caused by direct deformation, inflammation, and ischemia. Essentially, the structural integrity of the cells fails, causing a positive feedback loop of damage until a pressure injury is formed. So pressure injuries are also a lot more common than you would think, affecting 1 in 4 Canadians across all healthcare settings, yet 70% of them are preventable. Further, pressure injuries take a long time to heal. Looking at this diagram, it shows that the probability of still having a pressure injury after 1 year is approximately 80% for stages 3 and 4 and unstageable pressure injuries. Pressure injuries also cause a lot of pain and suffering, leading to large physical, mental, emotional, and financial burden. So looking at treatment, repositioning at 2 to 4 hour intervals is commonly accepted as the single best practice for the prevention and treatment of pressure injuries. Specialized mattresses can also be used to aid in repositioning, but evidence shows that they're insufficient alone, meaning they can't replace the need for repositioning. Unfortunately, adherence rates to repositioning are poor in clinical settings, and they're expected to be worse in home care, meaning patients aren't being repositioned as frequently as needed. So to address this issue, our overarching goal for the project is to develop an in-home prompting system that uses data from 4 load cells under each leg of the bed to notify a caregiver when a patient requires repositioning. This would ensure appropriate and timely repositioning and hopefully promote faster healing. So previously, we developed a machine learning classifier to predict participant position as supine, left side, or right side lying based on data from 20 healthy participants in a simulated home environment. We found that a feed-forward neural network model with 30% incremental learning performed best with an accuracy of 94.2%. However, the accuracy dropped to 70% when the model was tested on real-world data. So we realized that categorizing participants into 3 positions was limiting the generalizability of our model. Therefore, we suspect that the loss in accuracy is due to the fact that there's a wide variability of side-lying positions between supine at 0 degrees and full side lying at 90 degrees that are seen in the real world. So to tackle this and make a better model, our new research question centers around designing a classifier that can predict a continuous angle theta between the bed and the trunk when the patient is rotated in the transverse plane, as seen here in these figures. So our methods will follow this diagram. So the study will be conducted in a simulated home environment with data from a convenient sample of 20 healthy participants. Inertial measurement units will be attached to the sternum and anterior thighs and to the head and to the bed in order to measure the ground truth for the transverse trunk angle and the angle of the head of the bed respectively. Participants will then be positioned in a series of commonly used poses, some of which were shown on the previous slide. Next, data pre-processing will isolate the usable parts of the data from which we will identify our features. So the features used will be flexible, meaning they can change depending on what is being predicted, since different movements and static positions may require different features for optimal performance. For example, to classify movements, a multi-level binary tree classifier will be used, and it will use different features at each level. And to classify static position, a logistic regression, feed-forward neural network, support vector machine, and a multi-level binary tree classifiers will all be tested, and they will also use flexible features where possible. So moving on, a rule-based approach will also be implemented to improve the accuracy by taking the movement and static position of the patient at the previous position to narrow down what future positions an individual can assume. And to wrap things up, we will also be repeating this with incremental learning at for 0%, 10%, 20, and 30%, and we'll also use the leave one out cross-validation approach. So lastly, I want to leave you with 3 key takeaways. So first, no other pressure injury research or technology related to intelligent prompting is being targeted towards the home care setting. This means that this is a hugely neglected field, and it needs to be addressed, and this is a very simple solution we can implement. Second, our solution will provide more information about bed positional patterns, which will allow for more personalized and patient-specific care plans. And finally, it will reduce the burden for all parties, leading to a better quality of life. Thank you.